Have you ever really thought about what happens when you call 911 for, say, a really bad stomach ache? What goes on in the back of that ambulance? Well, I can tell you it is definitely not guesswork. Today, we're going to pull back the curtain on an official EMS guideline and look at the exact playbook paramedics use to turn that chaos into care. So imagine you've made that call. Your stomach is just killing you, you feel terrible, and you can hear the sirens on their way. The professionals who walk to your door, they aren't just winging it. Nope, they are following a very specific, highly structured script. A playbook, really, that's designed to figure out what's wrong fast. So let's walk through that playbook together. All right, so here's how we're going to break it down. We're going to follow their process exactly. We'll start with the crucial opening questions. Then we'll look at how they search for physical clues. After that, we dive into the real detective work of narrowing down the cause. And finally, we'll look at the specific treatment protocol they're following on scene. Okay, first things first. Before they even think about pulling out any equipment, the investigation starts with a simple conversation. You see, the most powerful tool they have right at the beginning is you. It's your story. And this is right where the detective work kicks off. Just look at these questions. Every single one is a critical clue. They're going to ask about your last meal, right? That could point to food poisoning. They'll ask if you've traveled recently, maybe looking for certain infections. For women, the pregnancy question changes everything. Each one of your answers is like a breadcrumb, helping them build a map of what's going on inside your body. So the big takeaway here is that you're not just a patient in that moment, you are the single most important source of information they have. How clearly and honestly you answer their questions has a direct impact on how quickly and how well they can help you. You're basically the lead detective on your own case. So once they have your story down, the paramedics switch gears. They go from listening to observing. They start searching for the physical clues, the signs that can either back up what you've told them or maybe challenge it a bit. And think about this for a second. Just changing how you describe your pain can point them in totally different directions. Is it intermittent, like it comes and goes in waves? That might suggest something like a gallbladder issue. Or is it a constant, dull ache? That could be something else entirely. The words you use really, really matter. This list really shows you just how wide of a net they cast. I mean, a cough and a fever along with stomach pain? You might not think they're related, but that could actually be pneumonia. Or a rash. Maybe that points to some kind of systemic infection. Paramedics are trained to see the body as this big connected system, where a clue over here can solve a mystery way over there. Okay, so with your story and the physical clues in hand, the next phase begins. And this is where their training really starts to shine. They start building a list of all the possible suspects, all the things that could be the culprit. Now, in medicine, there's a name for this list. It's called a differential. It's just a systematic way of thinking through every possibility, from the most common and simple to the most critical and life-threatening, just to make sure nothing gets missed. And this is where things get really fascinating. When you look at the official list of potential causes, you realize pretty quickly that stomach pain isn't always about the stomach. It could be a complication from diabetes, a neurological issue, or, get this, even something you would probably never expect, like a heart attack. And this right here, this is a potentially life-saving piece of information, especially for women and for older adults. That classic chest-crushing symptom of a heart attack, it might not ever show up. Instead, it can feel just like indigestion or nausea. And that possibility is exactly why paramedics follow this protocol so rigorously on every single call. So, after they've gathered all the clues and weighed all the possibilities, it is time to act. This is the part of the playbook that lays out exactly what they need to do to get the patient stabilized. Just look at the logical flow here. It all starts with assessment, getting your vitals. Then, they get ready to intervene by starting an IV. And notice step 3, consider cardiac monitor/ECG. That's a direct callback to that risk of a heart attack we just talked about. See? Every single step is connected. A lot of the time, one of the first and most powerful things they can do is rehydration. I mean, if someone's been throwing up, getting fluids into them is absolutely critical to stabilize their blood pressure and just help them feel better. And the protocol gives them a precise formula for this, which is what you're seeing here. It's simple, it's fast, and it is incredibly effective. The protocol also gets super specific with medications. For a common anti-nausea drug, for example, they have an exact dose they can give, 4 milligrams. This isn't just an estimate, it's a precise amount that's designed for the best possible effect with the most safety. And it doesn't just stop there. What if that first dose doesn't quite do the trick?
Well, the playbook has a clear guideline for that, too. A second dose can be considered after 15 minutes. Everything is planned out.
And safety, of course, is everything. The playbook has these hard stops built right in, like this one. Absolutely no ondansetron for infants. This just shows that these guidelines aren't only designed to be effective, they're designed to proactively protect the most vulnerable patients from any possible harm. So when you put it all together, what you have is a clear, evidence-based process. From the very first question they ask to the last drop of IV fluid, every single action is guided by a protocol. It's a system that's designed to remove the guesswork and to deliver the best possible care every single time. And that really brings us right back to the beginning. We've seen this incredibly detailed, systematic playbook that paramedics follow. But what's the single most important part of that entire process? It's you. Knowing everything we've just covered, the most powerful thing you can do in a medical emergency is be a clear, calm, and honest historian for your own body, because that's the first step to turning chaos into care.